right, hi everyone. This is Vanessa with mConsent. Today I have Samad, our CEO and owner, with us, and we are interviewing Dr. Francine Estrada. Dr. Francine Estrada is a cosmetic general dentist that has been serving the people of New York for more than a decade. Born and raised in Los Angeles, she moved to New York City to complete her residency experience after graduating from UCLA Dental School in 2006. Dr. Francine Estrada has highly specialized training in all areas of general and cosmetic dentistry, from veneers to aesthetic crowns to laser treatments, Invisalign, Botox injection, and implants. Her research has been published in the American Journal of Respiratory and Critical Care Medicine, and she is an active member of the international team of implantologists and Academy of Laser Dentistry. Her passion for helping people feel confident about her smile extends from her practice and patients into her ongoing commitment and continuing education in the field. Dr. Estrada's goal is to make genuine connections with her patients and heal and nurture their overall health so it shines through their smiles.
Thank you, Vanessa. Thank you, Doctor, and thank you for joining us today. Before we start the interview, I would like to say that, how much I appreciate all the healthcare professionals out there who are at the front lines, during this pandemic, helping people out, serving people, and, taking care of them. Especially, I wouldn't imagine my son had a dental incident, and if people like you were not in the office and helping us out, I couldn't imagine what it would have been. So thank you so much for being on the front lines and taking care of people while we are dealing with this pandemic here. Thank you, Doctor.
Well, thank you for having me, and that's my job. So glad to do it. I'm happy and that I'm healthy enough to do it as well.
Thank you. Yeah, thank you. So with that being said, Doctor, what I have is that I have a few questions that will really help me understand how your practice is able to work during this pandemic, because people are concerned about hey, how do I go to a dental office during this pandemic? So if you can talk a little bit about some of the precautions you're taking during the COVID times and to keep your employees and your patients safe. So if you can talk a little bit about that, that'll be really helpful. Thank you.
Yeah, sure. So basically when it first started, we really didn't know how to come back to work. So I did research, and basically everyone was doing screening. So whenever a patient would call, we would screen them, ask them a series of questions to make sure that they haven't been exposed, they weren't having symptoms, COVID symptoms, and that they hadn't traveled on an airplane and all that stuff. So we did that when we booked the appointment. Now, when we confirmed the appointment, we went through those series of questions again. And when they came in, we went through the same series of questions again, and we actually had them sign it. So at that point, when they come in, we also take their temperature, and we have a pulse oximeter, which measures their O2 saturation in their blood. And we ask them to wash their hands. We have hand sanitizer everywhere, but there is nothing better than washing your hands. Once they wash their hands, then we could proceed with, if they're a new patient, they have to fill out the new patient forms. If they're, just coming in for a recall and they're an existing patient, then we just have them sit in the chair and we proceed as usual. We have full PPE, KN95 masks, or level 3 masks, face shields, surgical gowns, and all the rooms are cleaned as if we were doing a surgical procedure. Medical grade antibacterial sprays, and even in the front, I actually have my staff clean the doorknob, any type of buzzer that was touched, after every single patient. So we have Lysol wipes. She gets up and, someone comes in, she's right out there, right behind them, cleaning off all the surfaces that they have touched, front desk, everything. So we've had to accommodate for that. So every appointment's about 15 minutes longer, so that we don't get too backed up and we don't have more than one person in the waiting room. If we do, we immediately remove one patient and bring them into an operatory, so they feel comfortable.
Awesome.
social distance. You know, it's hard in New York because everything's so small,
Yeah, yeah, that's
tight.
true. That's true. Thank you. What would you tell your patients who are watching this and planning to come? What do you expect from them before they come over? Any instructions you have? Like some people have asked them to stay in the car. We'll come and get you. Anything that you have of that kind before they come in?
Yes, I've heard of that. Unfortunately, in New York, most people don't drive. They take the subway. I've had a lot of patients just, you know, admit like, listen, you know, I took a plane ride and, you know, I didn't realize. And honestly, all I want is honesty.
Mhm.
If you've been in contact with someone who is sick or who might be sick, cancel your appointment. Call me up, you know, or if you don't feel well the day of the appointment, just call me and cancel. Just say, I don't feel well. I don't know if it's allergies. I don't know if it's a cold or, you know, let's just cancel and be on the safe side.
Mhm.
I think most of my patients have been very honest, and I really appreciate that. I've had a few patients who early on and, you know, recently called me up and said, you know, my boyfriend or my wife had, you know, didn't feel well. She got tested and she's positive, and I just saw you. So, you know, we just take the precautions and let the staff know, and we all get tested.
Mhm.
Um, you know, and thank God we've all been healthy. And I think having the PPE and just cleaning, you know, we've all gotten lucky that none of us have gotten sick.
Mhm.
Yeah, that's interesting. Yeah, it depends so much on the people that you work with. You know, that's
Yep.
you know,
Right, right.
that's
Well, that's a good point. So the people, my staff, we've all come to, you know, respect one another and enjoy working with each other. And I ask them to be very responsible. And so they don't travel, they are with their family. And we have continued to have a small circle of people that we associate with. So they don't go out with friends. They don't, you know, even though, you know, they could do what they want, they have free will, but we just thought out of respect for each other, we don't want to expose one another by doing, you know, social events or whatever they have. So Thanksgiving was basically, we all were just with our immediate families, and we're continued to do that throughout the holidays.
Mhm.
And if one person does, you know, end up going on a plane or going somewhere, I've asked that they quarantine. I've asked that they take 2 tests. I want 2 negative tests. And same with my patients. If they had been sick, I just want them to quarantine for 2 weeks. And if they've been exposed or might have been exposed, I require 2 negative tests before I can even schedule them again.
That's a very good point that you mentioned the 2 negative tests. That's important, I think,
Right.
because I know someone who took the first test, it was negative. The second test came out to be positive. So I
Yeah.
think that's a good point. You know that the
Yeah.
2 test actually helps you out in making sure that you know it's not just a fluke or something.
Right.
Um, the one question that I have is that during this time, I know technology has become very, very important, like the Zoom call we are having, right?
Yeah.
What is in your office that has helped you during this pandemic? Like, how did the technology help you? What would you like to mention? Give us a few examples that how you have been able to use the technology.
So when this whole pandemic started, I knew I really needed to up my game, and mConsent was something that I had heard about, and I thought, wow, this is brilliant. Why, you know, have people, you know, touching the clipboard, all this paper, you know, pens and everything. If that could all be eliminated and a patient walk in and you know who they are, and they go directly into the operatory and they don't have to sit in your chair and, you know, handle all that stuff, that was brilliant to me. I said, I have to do this.
Mhm.
I never had, I looked into it, but I never fully was on board with a lot of the online forms because I could customize it. No one knew the coronavirus was going to hit us and stay for this long, you know. So um, I think having a forms that you can customize and send to a patient and have them fill them out in the comfort of their own home or walking, or, you know, everyone's on their iPhone now, and have it sent to me, and I could do everything, streamline their visit, and it's just so much more efficient and less contact. You know, that's actually just completely a no-brainer for me. I loved that. And also it cuts down on paper, and we're saving the universe here.
Agreed. Yeah, I have the same feeling here. You know, every time you print less paper, you know, you're making an impact, whether you know or
Yeah.
not. You're making a big impact. What would you advise to offices like you, for who are planning to use something like this, but they haven't made up their mind yet? What would you tell? Like a couple of things. What would you tell about your experience with mConsent?
So one thing that I've noticed is that, you know, we've had a lot of trouble with staff. We're just always understaffed. So to have something like this and have it streamline it, and it basically decreases the time that your staff has to chase patients. Oh, you didn't fill out this one, or, oh, you know, you have to do this, and then scan it, and then shred it, and then, you know, integrate it in Dentrix. And I love that it's going to cut down on front desk. They're not going to get backed up. And that is key. I think obviously any dental practice, the biggest overhead is the staff, your employees. And if you can make their life easier and everything's more efficient, they could actually pay more attention to the patients, or a treatment plan, or calling post-ops and seeing how they're doing after a procedure, instead of scanning and shredding and chasing people and making sure they signed everything, because there's always that, no one ever signs everything. You always miss something, so they're flipping through and, oh, Miss Jones. So that's huge to me.
That's any other tools that you can think of outside, you know, what the paperless stuff? Any other tools that you think has helped you out?
Well, I really like the consents. Like if there's going to be an extraction, and, you know, you could take the iPad into the room and, you know, go over it. I think that's one thing that, you know, I'd never want to miss is, you know, informed consent. And once it's done, you know, boom, it's there forever. It's not a paper that's going to get lost and not get scanned. And God forbid there be something about, you know, oh, I didn't give you consent to take my tooth out. That, you know, that really is, you know, important to have that. I hope I answered your question.
Yeah,
Maybe I'm just going, okay. Oh, and the treatment plan. You guys are able to create treatment plans on a platform that I haven't seen before. And I love it that I could put in a treatment plan, take an iPad, bring it to the room. And in that room, when patients always have questions, because it's very abstract. Dentistry is very abstract. Like, I need a root canal. What? Why do I need a core? Why do I need a crown? In that moment, I could have them look at the treatment plan, and I could show them models. I can show them videos. I can show, it is so much easier to present a treatment plan and explain to the patient, you know, what needs to be done. And it's just so well laid out. My office manager loved it. So I think that's great. Instead of printing out a treatment plan, and then they're asking me questions in the front, and then I got to bring them in the back. And, you know, it's just, you know, and obviously sometimes they were too embarrassed to ask questions, and they should. What's the crown? Let me show you. You know, why should you know what a crown is if you've never had one?
Yeah.
Right.
I don't know either.
Yeah. Your teeth are beautiful. I bet you don't have any dental work you need.
Thank you. Thank you so much, Doctor, for your time. Appreciate, you know, you giving that lovely feedback to us, and you know, it means a lot to us. And thank you again for taking time out to, you know, talk to us and give your insights, and you know, best of luck with all that you're doing, and we really appreciate it.
Well, thank you, and thank you for creating a beautiful platform for us to do what we love to do and not focus on the minutia and have less paper. Thank you.